Hello, and welcome to Healthy Start. Today, we're diving into a critical topic that could save lives: 10 symptoms of a stroke you can't miss, some of which may appear up to a week before it happens. A stroke is a medical emergency, and recognizing these warning signs early could mean the difference between recovery and permanent damage. One of the most dramatic signs is loss of consciousness, which sounds extreme, so let's break it down. A stroke occurs when the brain is starved of oxygen. The brain, though only 2% of your body weight, consumes 20% or more of your energy. It's always working, whether you're awake or asleep, making it highly metabolically active. Without oxygen for even 10 seconds, you can lose consciousness. If that deprivation lasts for 2 to 6 minutes, permanent brain damage sets in. Those oxygen-starved cells die and don't recover. There are two main types of strokes, both caused by a lack of oxygen. The first, ischemic stroke, accounts for about 87% of cases. It happens when a blood clot blocks a blood vessel, cutting off the blood supply to part of the brain. The second, hemorrhagic stroke, is even more severe, making up the remaining 13%. This occurs when a blood vessel bursts, causing bleeding into the brain. Both are devastating, but their outcomes differ. Ischemic strokes kill about 3% of people immediately, and while they often reduce quality of life, rehabilitation can restore much or all of the lost function. Hemorrhagic strokes, however, are far deadlier, with over 50% of victims dying either immediately or within months to a year. There's also a third event called a transient ischemic attack, or TIA, often called a mini-stroke. TIAs share symptoms with strokes but are temporary, lasting less than 5 minutes. The oxygen deprivation isn't long enough to cause permanent damage, so recovery is usually complete. In an ischemic stroke, a clot, or embolus, travels through a larger blood vessel, but gets stuck in a smaller one, blocking blood flow to the brain tissue beyond it. After several minutes, that tissue dies. In a hemorrhagic stroke, a weakened blood vessel, often at a turn or point of high friction, ruptures. Blood spills into the brain, pulling between the skull and brain tissue, creating pressure and disrupting blood flow. A TIA, on the other hand, involves a temporary blockage. A clot might briefly lodge in a vessel, or a narrowing from plaque might reduce flow, but the obstruction clears quickly within seconds to a few minutes before permanent damage occurs. The exact mechanism isn't always clear, but the key is that the blockage is short-lived. While TIAs typically resolve within minutes, symptoms can linger for up to 24 hours, sometimes longer, leaving people feeling off. In fact, up to 40% of TIAs are later found to be small strokes when imaging is done, even if no permanent damage is noticed. Why does this matter? A TIA is a warning stroke. About 1/3 of people who experience a TIA will have a full stroke within a year. In one study, 43% of stroke patients had a TIA in the 7 days prior. This makes early action critical. If a stroke follows within a week, time is short. But if it's within a year, you have a window to reduce your risk. Many medical conditions, including TIAs, are underreported. People often ignore minor symptoms, especially men, hoping they'll go away. Major events like collapsing or needing emergency care get reported, but the small warning signs often don't. I believe if we pay closer attention, most people would notice some early clues. Let's explore the top 10 symptoms, starting with weakness or paralysis. This is a hallmark of a severe stroke, and it's sudden. Unlike gradual fatigue, it hits out of nowhere and is often unilateral, affecting one side of the body. The brain is split into 2 hemispheres, connected by a small stalk. The right hemisphere controls the left side of the body, and vice versa. So, weakness on the left side points to a stroke in the right brain. This is most noticeable in the face, arm, or leg. Facial drooping, where one side of the face sags or an uneven smile appears, is a telltale sign. Others might notice it before you do. Weakness can also affect smaller muscles, causing sudden difficulty swallowing, chewing, or speaking. Slurred speech is a common stroke symptom. Loss of fine motor skills, like trouble writing or buttoning a shirt. can also occur. Balance and coordination may suddenly falter, far beyond everyday clumsiness. The suddenness is key. These aren't gradual changes, but abrupt disruptions. The second symptom is cognitive changes. If you suddenly can't understand spoken or written language, a part of the brain responsible for language processing may be affected. Other cognitive issues include confusion, memory lapses, or trouble recalling information. Problem solving or decision making may become impossible. These changes are alarming because they affect how you interact with the world. Third, strokes can impact any of the five senses. Blurred or double vision is a well-known stroke symptom, often sudden and affecting one or both eyes. Numbness or tingling, especially in the face, hands, or legs, is another common sign. While less discussed, changes in hearing, touch, taste, or smell can also occur. These are often overshadowed by more dramatic symptoms like paralysis or vision loss, but they're part of the same process. Fourth, nausea and vomiting can signal a stroke, especially if they come on suddenly. Fifth, severe fatigue, feeling overwhelmingly tired out of the blue, is another clue. This isn't your usual tiredness, but a crushing exhaustion that hits without warning. Sixth, a severe headache, like an ice pick stabbing your skull, is a classic stroke symptom, particularly for hemorrhagic strokes. Unlike a typical headache that builds gradually, this pain is sudden and intense. Seventh, personality changes can be a subtle, telling sign. You might not notice these yourself, but others may see a shift in your behavior, mood, or emotional state. If someone you know suddenly acts out of character, it could be a stroke-related change in brain function. Eighth, difficulty speaking or slurred speech, as mentioned earlier, is a major red flag. Ninth, loss of balance or coordination can make walking or standing feel impossible. Finally, 10th, loss of consciousness, as we discussed, is a severe sign of oxygen deprivation to the brain. Here's the catch: there aren't truly early signs of a stroke. The symptoms of a TIA and a full stroke are identical because they stem from the same mechanism: blocked or reduced blood flow. The difference lies in severity and duration. A TIA is the early warning, but by the time it occurs, the process is already advanced. To catch things even earlier, we need to focus on risk factors and lifestyle, not just symptoms. Let's look at key risk factors. A history of a TIA or stroke significantly raises your risk. If you've had one, you're more likely to have another. Blood disorders, like sickle cell anemia, increase clotting risk, as abnormal blood cells clump more easily. Autoimmune diseases, such as lupus or rheumatoid arthritis, drive inflammation, which can predispose you to strokes. These are largely genetic or medical conditions you can't fully control, though lifestyle changes can help. Now, let's focus on lifestyle risk factors you can change. High blood pressure is a major driver, putting extra stress on blood vessels, which can lead to ruptures or blockages. It's not a symptom, but a risk factor, despite what some sources claim. Smoking and tobacco use are obvious culprits, damaging blood vessels and promoting clots. Excessive alcohol consumption also raises risk by affecting blood pressure and liver function. A sedentary lifestyle is another factor. Your body is designed to move, and exercise drives critical physiological processes. Sitting all day increases stroke risk. Certain medications, like birth control pills or hormone replacement therapy, can elevate stroke risk by affecting blood clotting. Stress is another major player, putting your body in fight or flight mode, which shift priorities away from healing. Finally, insulin resistance, type 2 diabetes, and metabolic syndrome are huge contributors. These conditions drive related issues like cardiovascular disease, high blood pressure, poor circulation, chronic kidney disease, and peripheral artery disease. I don't list these as separate risk factors because they stem directly from insulin resistance and metabolic syndrome, which you can address through lifestyle changes. So, how do you reduce your risk? Stop smoking, limit alcohol, and start moving. Exercise isn't optional, it's essential. Address high blood pressure and insulin resistance through diet and lifestyle. A low-carb, high-fat diet, like keto or paleo, can reverse insulin resistance in most cases. Managing stress is also critical. Meditation, mindfulness, or therapy can help. Over time, as you heal your body, you may reduce or eliminate the need for medications. Don't stop them abruptly, but work with your doctor to address the root causes. The problem is, up to 88% of people have some degree of insulin resistance or metabolic issues, but standard blood work often misses it. Tests like hemoglobin A1C, fasting insulin, triglycerides, and VLDL can reveal where you stand. For example, an A1C below 5.3 is ideal, and fasting insulin should be under 5. Triglycerides should be under 100, and VLDL under 20. If you're diabetic or insulin resistant, act now to reverse it. If you've had a TIA, treat it like an urgent wake-up call. In conclusion, don't wait for a stroke to strike. These 10 symptoms: weakness, cognitive changes, sensory issues, nausea, fatigue, headaches, personality shifts, speech problems, balance issues, and loss of consciousness are your body's way of sounding the alarm. Act early, address risk factors, and take control of your health. If you found this video valuable, please like it, share it with friends and family, and subscribe to Healthy Start. Hit that bell icon to turn on all notifications so you never miss a life-saving video. Thanks for watching, and here's to a healthier you.